very much, Chris, for that kind introduction, just like we wrote it. I think this sign up here really says it all about investing in prevention and in health. The chronic health concerns that we have is certainly what costs all the money and is the long-term problem. But, thank Des Moines University for hosting this here today. I've had the chance to visit here several different occasions, and I wish Dr. Franklin were here, but give her my best, please. And I know what it's like to take kids off to college like that. So we've had 3 of them thankfully graduate and leave home. I do appreciate the warm welcome and the opportunity to participate in the Healthy Discussion Series. The Partnership for Better Health is playing, I think, a very important role in focusing our attention on lowering healthcare costs and improving healthcare outcomes in the long term. I know there's a number of medical students here, which I had the pleasure of meeting, and as well as those representing patient groups and parts of our healthcare system here in Iowa. And I thank you all for being here. Your input is critically important as decisions are made in Washington because they affect nearly every person involved in receiving or providing health care. I'd like to have a productive discussion today. I've got a few prepared comments here, and then I'd like to open it up for your questions. As you know, the future of the President's new health care law is a central issue in this next election. It will the result will determine much of the direction of healthcare policy for the foreseeable future. For those of you who are entering the healthcare profession, I believe there's an enormous amount at stake for you, because the healthcare law will bring many challenges for those who have dedicated their lives to this work. For example, I'm very concerned about the impact of the Independent Medicare Payment Advisory Board, known as the IPAB, which consists of 15 unelected bureaucrats charged with cutting Medicare payments primarily to physicians. The law makes it nearly impossible for Congress to override any of the board's orders and shields the board's decisions from judicial review, as well as from input from patients and the providers who will be affected. The President's plan for Medicare relies heavily upon the IPAB to lower Medicare cost growth, and he proposes to actually strengthen the board's powers even more so. And for these reasons, I voted in favor of the House legislation this year to repeal that board. Another concern is that half of the newly insured under the health care law are covered simply from expanding Medicaid eligibility, increasing by 1/3 the number of Medicaid patients within 10 years. And as you know, Medicaid is in many cases a low-cost provider and payer, and expanding the Medicaid program will make it difficult for many physicians to continue participating in it. I think it's extremely unfair that if Medicaid patients can't get access to the care they need because of those limitations, they're actually barred from participating in the new healthcare exchanges as an alternative. Exchanges are a sensible way, advocated by free market analysts. Unfortunately, the healthcare law took this market-based idea and twisted it into a mechanism weighed down with regulations and government restrictions. Will do little to foster competition. According to the Congressional Budget Office, as you know, which is the supposedly independent group that we look to for scoring, the result will actually be 10 to 13% increases in premium costs, around $2,100 average per family in the exchanges compared with the current non-group market. Only about half of exchange participants will receive subsidies to help pay for these increased premiums. Despite spending more than $2 trillion, cutting Medicare by more than $700 billion, and increasing taxes by over $800 billion, the law does not lower health care costs. In fact, the most recent government projections show that by 2021, increases in national health care expenditures will be nearly 30% greater due to the health care law. The law is also flawed, I believe, for what it does not include. It does not provide a fix to the unworkable Medicare formula, which has required Congress to scramble every year to prevent enormous cuts to physician reimbursement. It's astonishing and I think outrageous that the largest change to our health care system since the creation of Medicare would fail to fix this problem. It hurts the physicians in Iowa because they already receive some of the lowest Medicare reimbursements in the country. And if you look at what the health care bill did include, was student loans. Because they got $80 billion worth of credit for including student loans, but excluded the doc fix. Here's health care reform without doctors, but student loans aren't. That would cost about $232 billion at that time. Today, the price tag is going up to about $300 billion over 10 years for that fix. Not included. This is something that's going to go on and on and on. The cliff that you're facing as physicians at the end of the year is somewhere around 30% of your reimbursement will be cut if, in fact, those changes aren't made. But that was not part of the health care bill. To me, unbelievable. The law also fails to offer any significant solutions to the medical liability costs. According to the American Medical Association, it's the reason why half of the counties in America do not have an obstetrician, why medical students choose specialties based on avoiding frivolous lawsuits, and why 80% of physicians practice defensive medicine because they fear lawsuits. It's a boon to trial lawyers because they, with 125,000 cases in the system on any given day. To put this number in perspective, it's more than twice the number of medical students in the country. The point I want to get across to you today is this. The direction of healthcare policy I support will correct these problems and allow for the kind of innovation and efficiencies that will limit the growth of healthcare costs. The President's plan simply does not. There's an effort in Congress to repeal and replace the law, and I'll support that effort. But I believe there's a great deal of common ground that can be reached. After all, Republicans and Democrats share the goal of addressing the millions of Americans who are underinsured and have no health insurance at all. I've offered H.R. 364, the common sense health reform Americans actually want act, which is a replacement proposal that includes many reforms that have a track record of bipartisan support. It would first guarantee coverage by modifying, expanding, and adequately funding high-risk groups to cover at an affordable rate anyone with a pre-existing condition who is unable to obtain affordable insurance elsewhere. It would also create nationwide competition between insurance carriers by allowing individual policies to be purchased across state lines. It would establish small business health plans where businesses can pool together to negotiate lower health care premiums. The bill includes common sense medical liability reform, which will save taxpayers more than $50 billion and even save even more in total health spending as the practice of defensive medicine is reduced. Furthermore, the legislation would retain certain provisions in the new health care law that are already in effect. Provisions that enjoy widespread support among Americans, including preventing insurers from unjustly canceling policies, eliminating annual and lifetime limits, and allowing dependents to remain on their parents' policies until age 26. The bill would lower health care costs for millions of Americans without adding a penny to the deficit. It can be done. Now I'd like to really shift topics and talk a little bit about Medicare, which, as you may well know, is the 800-pound gorilla in the room when it comes to health care. First of all, reforming Medicare is not optional. The program is on the path to bankruptcy, and the trustees report that Part A trust fund will be completed in just 12 years or in 2024. An average couple now retiring and becoming eligible for Medicare is expected to have medical costs more than double what they paid in Medicare taxes when they were working. Without serious reforms, this gap will have to be financed by higher and higher taxes or more deficit spending, which is an enormous and I think unacceptable burden for today's young people. The President's health care law claims to help Medicare's finances, but it counts the $700 billion in cuts to Medicare twice. Once to extend the solvency of Medicare, and again to pay for the massive new entitlements for non-seniors, people not involved in Medicare, created under the law. Simply by paying doctors and hospitals less, without other reforms, the Medicare actuaries estimate that as many 40% of the hospitals, nursing homes, and home health care agencies will eventually be forced to either close their doors or stop seeing Medicare patients. This is something that we're already beginning to see in Iowa, and it will only get worse without other changes. Medicare's inefficient and fragmented fee-for-service payment structure makes it an open-end program that is ultimately unsustainable. I believe that innovation in payment structure and care delivery is the solution. I know many of you are working on these solutions, and I've talked with several of you about what you're doing. You are the experts on how to deliver the highest quality health care at the lowest cost to patients in Iowa. Not Congress, not federal bureaucrats, and not the President. I believe the government should get out of the way and give you the freedom to craft solutions for the future of health care in this country. Medicare needs a reform plan that harnesses this ingenuity. The House Republicans have proposed a bipartisan plan developed by House Budget Committee Chairman Paul Ryan and Democrat Senator Ron Wyden. It's the only credible plan proposed so far that would save Medicare from bankruptcy, allowing beneficiaries to receive the same or greater level of benefits at a lower cost. Future Medicare beneficiaries would have a choice of Medicare plans in addition to traditional Medicare. They can keep what they have that are competing for businesses. These Medicare health plans would also have to offer coverage that is equivalent to traditional Medicare. While the premiums, benefits, cost sharing, and provider reimbursement structures could vary, the value of the plans would have to be the same. The government contribution would be similar to what is currently under traditional Medicare. Those who are older, sicker, and have lower incomes would get additional help for any out-of-pocket expenses. The idea of choosing a Medicare health plan isn't new. Traditional Medicare is already unaffordable for most people, as 90% of seniors already have some type of supplemental insurance to pay for out-of-pocket costs, paying an average of $150 per month in addition to the Part B premium. Government bureaucrats and Congress now make decisions on Medicare coverage and procedures and determine what hospitals and doctors get paid down to the smallest item. Not only are these decisions often disconnected from reality on the ground, but the lengthy and cumbersome process often becomes politicized. Because Congress is involved, it should be no surprise that it can take years and even decades to resolve the smallest problems. This is why Medicare coverage often lags far behind most private insurance. Wouldn't it be great if we could remove politics, micromanagement, and bureaucratic decision-making from the equation? Let the people who actually take care of Medicare patients come up with a solution. No matter what the outcome of the election in November, the country needs your expertise, and I strongly encourage you to stay engaged. Give us your advice, your counsel. The decisions being made are certainly very, very important to you in the future. I'm willing to work with anyone, regardless of party affiliation, to find a solution to Medicare for the Medicare